Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Anambra State flags off second phase of vaccination as Plateau receives consignment of Oxford, AstraZeneca and Moderna vaccines. Katsina State government urges residents to get vaccinated for protection against coronavirus infection. And New Zealand sees a drop in new coronavirus cases, which authorities attribute to a strict nationwide lockdown. Eleven more deaths have been recorded in Nigeria following last night's update of the coronavirus death toll, which now stands at 2,480. The Nigeria Center for Disease Control, NCDC, explains that a backlog of 8 deaths were recorded for Delta State, and a backlog of cases in Delta, Bayelsa and Akwa Ibom raised the total infection reported on the 1st of September to 582 new cases across 15 states and the FCT. Here's more on the update.
The latest data from the Nigeria Center for Disease Control, NCDC, shows that the daily COVID-19 infections in the last 24 hours are at 582 amid the spread of the Delta variant in the country. The figures reported from 15 states and the FCT indicate a drop from the figures reported earlier. Lagos led the chart with 175 infections. 124 cases were recorded in Rivers, 60 cases in Edo, 57 in Delta. Akwa Ibom had 44, Anambra 25, while Bayelsa had 22 cases. 19 cases were registered in Gombe, 12 in Ekiti and the FCT. Kaduna had 11, Kano had 6, 5 cases were recorded in Benue and Plateau. Ogun had 3 cases, while Jigawa recorded 2 cases. The latest update also includes a backlog of cases for South states, including Delta, Bayelsa, and Akwa Ibom. There were 0 cases reported from Abia, Ondo, Osun, Oyo, and Sokoto states. The overall count of confirmed cases in Nigeria now stand at 193 and 13. 241 people have been discharged in the last 24 hours, increasing the total number of recoveries to 179,000. 11 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality to 2,480. Presently, there are more than 11,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. Over 528,000 eligible Nigerians have been vaccinated with the first dose of Moderna vaccine, while over 34,000 eligible Nigerians vaccinated with the first dose have taken the second dose of AstraZeneca vaccine. In Africa, there are more than 7.8 million confirmed cases and over 197 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 218 million, while more than 4.5 million deaths have been reported.
Governor Willie Obiano of Anambra State has flagged off the second phase of the COVID-19 vaccination using the AstraZeneca and Moderna vaccines at the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amaku, Awka, the state capital. The state received 58,100 doses of the Moderna vaccines and 13,792 doses of the AstraZeneca vaccine. Governor Obiano also appeals to the people of the state who are yet to take the vaccine to do so, assuring of its safety while reminding residents to still keep the COVID-19 preventive protocols going.
On March 11 this year, Anambra State Governor Willie Obiano took delivery of 78,810 doses of the COVID-19 vaccine during the flag-off ceremony in Awka, the state capital. This time, the state has 58,100 doses of Moderna vaccine and 13,792 doses of AstraZeneca. The Executive Secretary of the Anambra State Primary Healthcare Development Agency and a World Health Organization representative notes that though 98% vaccination of the target population has been achieved in both the first and second doses, more people need to be given the jab.
As we begin today to vaccinate the rest of the population aged 18 years and above, we shall achieve the much-needed herd immunity to ward off the rampaging virus, especially its deadly Delta variant.
Many of our people are skeptical, and I must emphasize it, about the COVID-19 vaccination and the vaccines. But I must say that unequivocally, without mincing words, that these vaccines are safe. Many of us have taken it. I've taken this vaccine. I've taken 2 doses of AstraZeneca.
Residents can use any vaccine, but are warned not to mix different types.
So I want to confirm that this vaccine is harmless. It is going to help you, So if you want to take any vaccine, whether it's AstraZeneca or Moderna, please make sure you do so.
62,167 people have been vaccinated so far, and the government hopes that vaccination will continue at the speed of the first phase to achieve herd immunity in no distant time.
Meanwhile, the government in Plateau State, north-central Nigeria, has taken delivery of more vaccines that will cater to citizens that have received the first jab, awaiting their second, as well as for those yet to be inoculated. The State Commissioner of Health, Dr. Nim Kong La, said in Jos, Plateau State, that 22,480 AstraZeneca vaccines, as well as 26,880 Moderna vaccines, have been received by the National Primary Healthcare Development Agency. Over in Katsina State, government has called on residents to take advantage of the availability of the COVID-19 vaccines being supplied to the state. The state has received a total of over 20,000 doses of the AstraZeneca COVID-19 vaccines. Meanwhile, in August, almost 100,000 Moderna vaccines were sent to the state. According to the state government, the vaccines will be administered on residents ages 18 and above.
These vaccines are available, they are safe, they are efficacious, and you can go to, any LGA and collect it. It's free of charge, and let them use and for our maximum protection from this pandemic. This is a good opportunity for people to do it while it is available. You recall that many countries have a restriction in terms of entry into the country because of the people who have not had the vaccination are not allowed to enter any country. And even for our general well-being, we don't have to be pushed to do that. It is part of civic responsibility for somebody to do something that will protect himself, his family, and the entire people at large.
Meanwhile, Ogun State government has since taken delivery of almost 200,000 doses of Moderna COVID-19 vaccines as it intensifies efforts to combat the third wave of the pandemic. Dr. Tomi Koka is the Commissioner for Health in Ogun State, and she joins us now for more on the fight. Thank you for taking time out. I know how tight it is for you to join us this evening on the program. Welcome.
Thank you very much for having me.
So let's begin. When Ogun State received the batch for the second phase of vaccination, you were worried that about the levels of mortality rates in the state. On some of the public health measures, and namely the non-pharmaceutical interventions, what more efforts is government applying, especially as we battle the third wave?
Well, in Ogun State, what we've done is we have a COVID-19 task force which monitor the compliance of the people. But we found that the strategy that works for us better is the risk communication, actually going out, engaging the media and advising people to continue to use the non-pharmacological interventions and providing them where necessary, particularly where there is public events where we have access to. We provide them with masks for those that don't turn up. And we also remind people that the directive of the government on the use of masks in public area still stands, despite the fact that the pandemic has been going on for over 18 months. So we don't know. We actually don't advise people to not use.
Talking about the non-pharmaceutical protocols now.
Yeah, what we encourage people to do is continue to adhere to those non-pharmacological interventions and stick to the protocol, just to ensure that we don't continue to have that spread. I was just trying to remember the second question, which was round about the death rates, which we've noticed. Particularly, we noticed in the last 2 weeks that we've had a death rate of about 14 people within a period of 2 weeks. And this has raised an alarm. That's why we've gone back to the media to ensure that people are aware of the rising death rate, particularly with this third wave, which we did not witness. We had about 27 deaths in the space of 4 weeks, whereas in the second wave, we had a total of about 15. And in the first wave, we had a total of about 50 over a period of 12 months. So people have to be conscious of the fact that we cannot be lackadaisical about not adhering to the non-pharmacological interventions.
And also, as much as vaccination is ongoing, they also need to continue to the non-pharmaceutical interventions. Staying with vaccination, you also receive the Moderna doses as well. But in terms of organization, are there more centers, more sites to expand vaccines, and also to make sure that, there's no vaccine mixing, especially for those who might have received an AstraZeneca before, and now what is being dispersed is Moderna?
So with the vaccination, initially people felt once they're vaccinated, they can do without the non-pharmacological intervention. So even though you're fully vaccinated, haven't received your 2 doses, you must continue. We received 176,000 doses of Moderna, and we have 131 sites, and we encourage everyone to go to their nearest health facility, which would be a tertiary center, a secondary facility, or our primary healthcare centers, or strategic vaccination points, because we've targeted schools, we've targeted anywhere where tertiary facilities, we've targeted prisons, just to make sure that we cover as many people in the state. Thus far, we have actually vaccinated 18,000 individuals with the Moderna vaccine. But we also have the AstraZeneca vaccine, because we had a discrepancy. We had 126,000 people vaccinated with the first dose of AstraZeneca, whereas there was only about 56,000 vaccinated with the 2 doses. So the people who received their first dose of AstraZeneca vaccination should really present themselves for the second dose, because we now have availability. The Moderna is solely for people who haven't had the first dose, because you have to stick to the same brand of vaccine. Once you've started with one, you can't cross over to another. So we implore people, anybody over the age of 18, to present themselves to be vaccinated, so that we can work towards this herd immunity that we all keep talking about.
I must put in this question very briefly, if you can, 30 seconds. And this is for those who have taken the AstraZeneca 1 dose before. If the time has lapsed, what now? Do they have to start all over again?
No, you don't, because your immunity has still been sensitized. All you need to do is present yourself to the nearest facility and get your second dose of AstraZeneca, which is available across the 20 local governments in Ogun State and in all the states in Nigeria as well. And if you've received your first dose in another state or another local government, you can present to any facility, what we call super sites. The super sites will administer your second dose to you. So don't be worried if you've had it in another state or another LGA. The most important thing is to have your full course of vaccination.
We'd like to thank you, Dr. Tomi Kokais, Commissioner for Health, Ogun State. Many thanks for joining us on the program.
Thank you for having me. Cheers.
Yes, well, South Africa to take vaccines to people's homes in an effort to curb hesitancy. We have that and more when we return. Please stay with us. Welcome back. Let's go to South Africa, where the Deputy President, David Mabuza, has announced that if people are hesitating to come out for a vaccine, then the vaccines will be taken to their homes. He was speaking during a vaccination monitoring drive in Mohale City near Johannesburg today. So far, nearly 13 million people in South Africa have received a shot of the vaccines, with 6.2 million fully vaccinated. Our South Africa Bureau Chief Betty Dibia reports.
A huge crowd followed the Deputy President, David Mabuza, accompanied by the Gauteng Premier, David Makura, everywhere they visited, to encourage people to get vaccinated against COVID-19. They went to shopping centers, taxi ranks, and local health centers. Deputy President Mabuza says owing to observed hesitancy among the people in some areas, the vaccination campaign will now be taken to their homes.
We're no longer going to wait here at the vaccination sites. We are going to take the vaccine to our people. Some are reluctant, some they're having fake news, rumors about the vaccine. So we explain to our people that no, the vaccine is something that will help them, not something that will kill them.
On the new virus mutation variant currently referred to as C.1.2 being studied in South Africa, the Deputy President says there's nothing to worry about for now.
Still under control. If we feel that this new variant is now a problem, the Minister of Health will announce and how best we want to deal with it.
Deputy President Mabuza will be continuing the vaccination monitoring exercise in other provinces in the coming days. The hope is to get about 40 million people vaccinated by December this year, as the third COVID-19 wave in the country makes way for a likely fourth. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Well, for more on the situation in South Africa, joining us right now is Professor Lekon Ayo Yusuf, is the Deputy Vice-Chancellor Research, Sefako Magatho Medical Sciences, Pretoria. He joins us now virtually. Thank you, Professor Ayo Yusuf, for joining us on the program.
Thank you. Good evening to your listeners and viewers.
Welcome. I mean, quite a unique strategy, taking vaccines to people's homes. My first question is, will it work, do you think?
Yeah, it would work. I think it should be taken into context for what the health systems in South Africa looks like. It is not the first time that care is taken to people's homes. In fact, at the first instance of the break, those who were frail and couldn't come out were taken care of at home. And we have what we call the world-based outreach teams that normally go out to the homes, and we've got community healthcare workers also delivering healthcare within communities. So it's just a matter of using the same vehicle. And we've always said that the countries that have a strong health system before the pandemic are going to be the ones that are able to respond more quickly.
Staying with that strategy, I mean, there's also vaccine hesitancy, which some might attribute to the reason why they perhaps are not coming out to take the vaccines. What do you think are some of the rumors or theories that are rife? And And why you think they're really listening to that rather than to come out, take the vaccines to protect themselves?
Yeah, again, I think it's a matter of trust and effective communication. Vaccine hesitancy, as WHO has described, it's about confidence in the vaccine itself. It's about comfort in how easily accessible are the vaccines, and which is now the response of the government to take it to people. We may assume it's quite easy to get onto a taxi or a bus for 50 Rand and go take the vaccine. It's not. It might be the last money for somebody who wants to buy bread. And once you find yourself in that situation, it makes it easier for you to believe when somebody tells you it doesn't work anyway. So all of this needs to be part of an effective communication to create confidence in the vaccine that it has been tested, it works, to make it accessible and easy for people to get it. And of course, build trust in the state that is providing the vaccine. Because once all of this is broken, then you have the result of what we're seeing right now. So it is oftentimes hesitancy is actually more in countries where there's already a lack of confidence in government.
How much more, and this is away from vaccines, talking about the new variants that we hear the country is watching closely, the C.1.2 variant. Right now, can we say it's a threat?
At this stage, it remains a variant of interest and not a variant of concern as yet. Variants of interest because, yes, there are genetic changes or mutation that suggest the changes could influence the transmissibility of the virus itself, but it's currently not as prevalent. The last time I checked was still about 1% of the samples. So it is not yet a variant of concern, but it is of interest because of the changes that we see, the mutational changes we see in this particular variant. I've always said it, I think I've said it on this platform before, there's almost nothing we can do about the fact that there will be evolution of this virus over time. The only thing we can do is to vaccinate or get to herd immunity quickly and as extensively as we can. So the longer it takes us to reach that, the more time the virus has to evolve and mutate.
All right. Well, I appreciate your time. Thank you so much. Always a pleasure having you join us. Professor Lekon Ayo Yusuf is the Deputy Vice-Chancellor, Research of Cargo, Magatho Medical Sciences, Pretoria. Thanks again for joining us.
Thank you.
And it's some positive news for New Zealand, where officials say a decline in new COVID-19 cases indicates its lockdown is limiting the spread of the coronavirus Delta variant. However, things are still critical in Australia, where health officials warn the health system is at risk. Here's a look at the global update.
New Zealand has recorded a drop in new COVID-19 infections, which authorities say shows the strict nationwide lockdown is working to curb the spread of the virulent Delta variant of the coronavirus. The country saw 49 new cases, all limited to the hotspot of Auckland. In neighbouring Australia, doctors warned that the country's hospitals are not ready to cope with the government's plans to ease restrictions, and the health system is facing the risk of being locked into a permanent cycle of crisis. Over the past 24 hours, the state of New South Wales reported 1,288 new locally acquired cases, just below its pandemic high of 1,290 on Monday. A total of 957 people are in hospital, up from 698 a week ago, while cases in intensive care units jumped nearly 40% to 160, 64 of whom require ventilation.
We have to accept living with COVID is a reality. It's not an option. And any state premier who thinks it's an option, unfortunately, is not considering what the real world experience is. And the real world experience is all of us as Australians, no matter where we live at some time, it might not be today or next week, But all of us as Australians have to accept that living with COVID is the future. It's not an option. It's not an option that any of us like, but it's an option we have to confront, and it's an option we have to support our citizens work their way through.
Taiwan has received its first lot of BioNTech Pfizer's COVID-19 vaccine after months of heated political and diplomatic wrangling. The 930,000 doses are the first of 15 million jabs acquired by Foxconn and Taiwan Semiconductor Manufacturing Company, as well as Buddhist charity Zhu Qi Foundation, in deals with a China-based distributor after months of wrangling. While the United States and Japan donated several million doses to Taiwan in June, the island has struggled to vaccinate its 23.5 million people. Over in India, the country has recorded its biggest single-day spike in coronavirus cases in 2 months. The country reported 47,092 new infections over the last 24 hours. And finally, 12 million students in France have resumed school under strict government rules like compulsory wearing of face masks. With inoculations now available for children from age 12, pupils are encouraged to get their shots. The daily average COVID contagion rate has slowed in France, and the government aims to administer a third vaccine shot to some 18 million people by early 2022.
Remember that the coronavirus can live on the surface for several hours, so continue to take responsibility. You can visit our website for an update on the pandemic, several other breaking stories. It's all news at your fingertips. Thank you. That's the program this evening. Thank you for watching. I'm Millicent Mwaka. Stay healthy.